This is a clinical assessment of the abdomen on my patient. I'm going to provide us with a little bit more light in the room. We're just going to keep on recording while we do this. Okay, so I'm going to start my assessment by inspecting the abdomen. And I'm going to expose your abdomen now. And we're just going to lift this up and just bring the pants down just a little bit there. Okay, so we've exposed the abdomen. First, what I want to do is inspect the abdomen. I'm looking for any vascularity. There are some stretch marks on the abdomen, which is a normal finding. I'm also looking for any lesions or rashes, and I don't see any lesions or rashes anywhere on the abdomen. Okay, so first I'm inspecting the abdomen. After inspection, I'm going to auscultate the abdomen, and I do also want to say that I have washed my hands and warmed them prior to the inspection, and now I will auscultate. I'm going to warm up the diaphragm of my stethoscope, so that'll be more comfortable for the patient. Before I do that, though, I am going to lower the head of the bed, and I'm going to have you lift your head when I tell you to, and I'm looking for any masses or anything to lift in the abdomen. So, sorry about that. I'm going to lower the head of the bed. And just continue to inspect the abdomen. Lift your head. Okay, lay it down. And lift your head again. Okay. And then just one more time. Okay. And I don't see anything protruding from the abdomen. And we'll just make sure that you're comfortable there. So next I'm going to auscultate the abdomen. I'm going to listen to each of the four quadrants. I'm going to listen to the aorta, the renal arteries, and the iliac arteries, as well as the femoral arteries. I'm listening for bruits. I'm also going to listen with the bell of the stethoscope. I'm going to listen to the epigastric and umbilicus, listening there for a venous hum. So first we'll start with the four quadrants, listening with the diaphragm. So I'm going to listen up in the right upper quadrant. I'm listening for about 30 seconds. And I'm listening for abdominal sounds to be between 5 and 30 per minute. And now I'm going to listen for the aorta, the aortic artery. I can hear the pulsation, the heartbeat in the aortic artery. I'm now going to listen to the iliac arteries. And I can hear the heartbeat in the iliac arteries bilaterally. And the femoral arteries. Okay, so I can hear the pulses with the diaphragm. I'm now going to listen with the bell. And I'm going to, with the bell of the stethoscope, I'm going to listen to the epigastric area and the umbilicus for a venous hum. Okay. So that is with the normal limits. I don't hear a venous hum. I am going to listen over the liver and the spleen. I'm listening for a friction rub. So first I will listen over the liver. Take a deep breath. And the spleen. I can hear your stomach going. Okay, so next I'm going to percuss all four quads. I'm listening for tympany over all four quads and dullness over the liver and the spleen. So I'm going to put my fingers on your stomach and I'm going to tap, and I'm listening for certain sounds. And now I'm going to percuss over the liver. I hear dullness over the liver and dullness over the spleen and tympany over the four quadrants. For the last part of the abdominal assessment, I'm going to do light palpation and then deep palpation. And I'm checking to make sure the abdomen is soft, non-tender, no guarding, and no palpable mass. Okay, so I'm just going to put my hands on your abdomen. Let me know if there's any tenderness or if anything hurts anywhere. I'm just feeling for anything unusual. Do you have any pain anywhere in your abdomen? No. Felt that hip bone right there. And I should have talked to the patient about emptying her bladder prior to palpation for her comfort. So with light palpation, the abdomen is soft and non-tender. I'm going to go ahead and stop and let the patient use the restroom before I do deep palpation. Okay, so the patient has had the opportunity to use the restroom. Her bladder is no longer full, so I'm going to do deep palpation. When I'm palpating deeply, I'm going to palpate around the umbilicus. I'm palpating for the aorta, and I'm going to hopefully be able to determine the width of the aorta and make sure that the pulsation is strong and regular. I'm going to try to palpate the liver. And I'm also going to try to palpate the spleen and then possibly the kidneys. Okay, so I'm going to do deep palpation now. So I'm going to put my hands on your abdomen and I'm just going to palpate deep into your abdomen. And I can feel the aorta feels normal. I can feel the aortic pulse, feels strong. I'm not really sure how large the aorta is. I'm going to palpate the spleen now. Okay, and come over here and Anything tender or hurting?
Just over here was a little tender.
Okay, where I was palpating very deep. Sorry about that. Go ahead and take a deep breath. And let it out. And I believe I'm feeling the liver. And it feels as if that's the edge of the liver. Okay. And let's see if we can palpate the kidneys. I'm not sure that I'm feeling the kidneys. I can feel your bowel moving now. So, you ate dinner already? Yes.
I have. Yes.
Okay. Okay. And we can go ahead and take your shirt down. Thank you so much for being my patient today and allowing me to assess your abdomen. I really, really appreciate that very much. And that completes my abdominal assessment.